Kate, we're back. I've been out with a back injury, as we know, and a little bit of blurry vision to concussion, but we're back and stoked to be back. And we're actually going to talk about injuries, funnily enough.
Yes, I hear you're annoyed.
I do get annoyed.
Yeah,
I'm 7 weeks, 8 weeks in, and I'm not able to do everything. So it is a frustrating state of an injury, right? You get to those points, you're like, oh, I just wish I could be further down the track.
Yes, I deal with this, I would probably argue, daily on a physio/strength coach basis. I am not getting any better, Kate. I'm doing what you say and I'm not getting any better. So yes, Tim, I understand this frustration. But the question is, why do you feel like you're not getting better? Or why do athletes, we can talk about your case, but for those listeners, like, why do you feel like you're not getting any better with your injury? What's your outcome measure that you're comparing that to? Or what are you thinking of? I'm not getting better because I feel like XXX. Why is that?
Yeah, what's interesting for my case, I think it's just my stubbornness of wanting to be back doing what I'm doing and the frustration of watching all the good weather just roll on by in Wanaka and come back. But I think for a lot of people, it's trying to find those key points around what is relevant per the type of injury that they have. And understanding the type of injury and the pain they might be experiencing and what they should expect along that pathway of getting better.
Yeah, 100%. And I think like you've nailed it there, because the reason that I generally find why athletes report that they don't feel like they're improving or that their injury is improving, because they expect, and again, we're such a visual kind of people, aren't we, Tim? I'm going to draw my imaginary axis here. So you've got, your time, and then time along the bottom, and then improvement along your y-axis. So people expect that their pain and their function are going to get better at the same time. And I think this is the issue, is that when we have an injury, over time we expect, one, our pain should improve, because most commonly people use pain as an outcome measure. And then two, they expect that their function should improve as well. And often we expect these two things should improve together. They go in this like beautiful linear relationship alongside each other. Oh, my pain's improving and I'm able to do more. But that's just generally not the case. And I think a big issue with that is perhaps miscommunication from healthcare providers or whoever is looking after that athlete on what reasonable expectations are. But generally they only improve in isolations. And that depends on the type of injury as well, right? So you might have something, let's take, for example, a fracture or a bony injury. You are going to feel your pain improve because hopefully you're going to be doing the right things and offloading it for a little while. So pain will get better. But sometimes athletes go, I'm not actually improving, because that pain improves slowly over time. And they're not necessarily able to do more either because they have to unload. So that will feel frustrating, but they actually are getting better because their pain is slowly improving, but they just can't do more. And then it's almost like the flip is true of that for things more like tendinopathies, for example, where you can train through pain. So therefore, if you are, and I said not like an 8 out of 10, but a 2 or 3 out of 10 pain is okay to generally keep running with these things. But then, of course, keeping on doing that, your pain's not going to get any better. So then, and that's okay because it will over time. But then the athlete misinterprets that as, I'm not getting better because my pain's not getting better, but they are running more or doing more. So that's a good outcome measure. But trying to get the two to improve together is really, really hard. And it doesn't always occur in injuries. In fact, more often than not, it doesn't occur in injuries that way, as much as we would love it to.
Yeah, it's a real difficult one. And actually, one of the hardest things I found in the last 7 to 8 weeks is getting some clarity from people around what I should expect, and how much pain can I push through, what should I expect the next day, what should I expect during, what should I expect 2 days later. And it was actually really difficult to get those answers. And I found that quite a frustrating part of that process of trying to understand what I can and can't do, or should or shouldn't do.
Yes.
Here's the answers. And I guess for me, as I've come through this, you do learn, there's just, you seem to take leaps. And I think what we find is initially we get some big leaps, and then those leaps slow down as well. And I think that can be part of the problem for people as well, is they expect everything to be on the same sort of linear progression. and leap forward really quickly. Really, you're going to get, like anything, you're going to get rapid improvement, and then it's going to graduate down as you go. And I think that's a really important part to recognise.
Yeah, absolutely. Or you might even see people have a rapid improvement and then they can actually go backwards a little bit, because let's say that it's an injury that doesn't require complete rest. So they feel a rapid improvement, say in their symptoms. So they do more, but then they're doing more. So their symptoms flare up a little bit. And that's not necessarily a bad thing. They were just doing more and loading that tissue more. So yeah, it's not that linear relationship. It just goes up, forwards, around, backwards, up, down, up overall. But as long as you look at it as an average, if it's improving in that linear relationship, that's good. But taking a few steps back is normal as well. It's frustrating. It's not to take away from the athlete and say, I hear you, I understand that's frustrating, that's important. But also it is a normal part of the process. And sometimes too, when it comes to rehab and testing out some training sessions, it is trial and error, because we might have these general guidelines as healthcare professionals where we can say, look, you can do this, you can't do that. We'll try this exercise, we'll try this rehab. But sometimes we don't know until you try them. And we know that in every research study, there's always outliers. So there are those really strong responders and there are non-responders as well. So sometimes some exercises you might think would be fine for a particular stage of an injury for an athlete might be too much for that athlete, or it might be too little as well. So that often comes with a little bit of trial and error. But I do find that sometimes healthcare professionals are really scared to take a chance on these kind of things and to push people as they should be. I think that our bodies are so much more robust than we give them credit for. And often we underload athletes and then they end up having this prolonged recovery. So generally, going back to your thought, Tim, when you said, I don't really know what I can and can't do, and I'm struggling to get those answers, I often find that comes from a little bit of conservative thoughts from a lot of healthcare professionals. And this isn't me bagging them at all either, because we're like that, because, if you do something wrong or you push someone too hard, that's going to come back and bite you and people get real grumpy at you. But then opposite is true too, where if you completely underload someone's going to get really frustrated too. But generally, research does support with musculoskeletal injuries such as tendinopathies or, shin splints, ITB syndrome, all these common injuries. Now, this doesn't include fractures, but these more common injuries, you can keep training with a 2 or a 3 out of 10 pain, and that's okay. But it's really hard sometimes to feel confident in yourself as a healthcare professional telling this person in front of you, push through pain, it's okay. Because it goes against the grain, I think, of what a lot of people have been told before or their beliefs. So it's really tricky. And then you're trying to say, it's all right, you can keep training with that 2 or 3 out of 10. It's okay. It will gradually get better over time, and you can increase your training load, or you can do these different types of exercises. But I think that's still not common practice. So it can be really confusing for athletes to know that that's okay or not. So it's definitely this real grey area, an area of confusion for athletes. And I think it is important that if you're not sure how you are feeling with your particular injury, that you do try and seek those answers. And the answers may be from a healthcare professional. We're just going to have to test it out a little bit and be prepared for a bit of this journey. But you want to know that, right? You want to have those expectations. Okay, it's all right to feel a little bit confused. That's a normal thing because everyone responds differently.
Yeah, completely. And the type of fracture or type of injury is going to have such an influence on that.
Yes.
And I think what I found really valuable was I went and tried to find someone locally that I could chat to and they could see my movements, my functionality, etc. But they had an injury rehab background. That's what they did. They worked in high performance sport and high contact sport and could sort of understand that and then help guide that process a little bit. And that's definitely for me helped, just giving me confidence that I'm not ruining myself at the same stage. I'm stepping myself forward.
Yeah.
And I think that's been really critical in helping me feel confident and giving me some answers.
Yeah, absolutely. And even having a good team around you and a team that works well together. So in the cases of fractures, obviously those pain levels don't apply. You want to be pain-free, obviously, before doing any form of exercise. But say let's talk about that scenario, whether it's a traumatic fracture but let's say a stress fracture, because that's more common in endurance athletes. You then want to have an understanding of your process from your sports doctor. You want to have an understanding of the process from your physio, from your coach. You want them all to be on the same level. You want to have an understanding from a nutritionist, because there's generally an element of and lack of energy availability or low energy availability there. So you need to make sure that you've got a team that are looking at all aspects for you. They all align in your mind, and then sort of have this tentative little plan, but then also know it's completely subject to change. And that's what's really hard. And yeah, definitely keep in mind, this is my injury and this is going to be my trajectory. My pain and my function most likely won't improve together. I am aiming for the first few weeks, we're going to settle the pain down. Decrease in pain might be the big goal, whether it's like not necessarily fractures in this case, whatever injury it is, you might go, this is just really sore. My goal is decrease in pain. You can't then expect at the same time to have an improvement in function necessarily with that. So you go, okay, short term, let's just get these pain levels down. Hey, look, they've settled. Okay, let's start our strength rehab focus. So your function may improve, but it may improve also in a different way, not your running, say, for example. You may be improving like your muscular endurance or your maximal strength or whatever that is. So yeah, it's really important to have that guideline of what you are focusing on and understand that trajectory. Your injury is still getting better. It just might not be the way that you've been educated on or aware of.
And it may not be initially to the endpoint goal of where you want to get to. I think it's really important. Like as you mentioned there, being back running, well, that actually may take a lot longer than you expect or an initial timeline represents. And something that I've learned recently with an athlete I've been working with is that we got over an injury, we progressed back, but because we missed a couple of steps around muscular activation and a bit of extra strength before bumping a little bit more of the load up, it's caused other issues to occur as well. And so really running should have been a little bit further down the track, and we put another couple of steps in there around that improvement curve to be super confident of loading when we got back running at more of a full noise.
Yeah, and like you pointed out then, Tim, it's like not necessarily saying then you guys did something wrong by testing out the running. Like you almost have to do that to know where you're at as well. So, and that would then result in you taking a few steps back, right? But it's going, it's kind of like a necessary evil. Like let's try and see, oh, nope, okay, I wasn't quite there. Damn, take a few steps back. Or you might have tried and gone, actually, I'm better than it was. But then the trouble with that is you go, hey, I can do this. I want to do more. It's like, no, hang on. Wait. Yeah, make sure that injury is okay.
Did that the other day. I was like, oh, look at my function go. I'm awesome. And then half an hour later, I just pushed it a wee bit too far and was pretty achy the next day.
Yeah.
But interestingly, it was nearly like a step backwards because a couple of days past that, I was then able to be way more functional and feeling a lot stronger in that space. So whilst I felt like I pushed that one too far, I responded really, really well to that. So that was a lucky outcome for me.
Yeah, good. And yeah, again, you just don't know those unless you try them. This isn't me saying, oh, everyone just go out and give it a little tester, but it's just don't be disheartened if you do try something and it doesn't quite work out. That's okay. Back to the drawing board. Okay, here we go. Let's keep going. Doesn't mean you're not improving. Doesn't mean all of your hard work and your rehab and your patience is not paying off. It just means for that particular outcome or what you were trying to do on that time, you're just not quite there yet. And that's okay. You are still improving.
Yeah, and that's key. It just comes out to that age-old adage, stick to your process, follow the process, and you'll get the outcome. And just try not to rush those steps along the way to getting to that outcome goal.
Yeah, absolutely. And I know over the next sort of few blocks, Tim, we're going to chat about what to expect with different types of injuries and rehab and strength and things. So I'm looking forward to our next few blocks of these to get stuck into a bit more of the nitty-gritty of some of these.
Yeah, awesome, Kate. Looking forward to that too. And thanks for our wee catch up today, and we'll catch you next time.
Sounds good, Tim. Thanks.